This module describes how to develop, provide, and explain a written transition policy. In this module, we describe what a transition policy is, its importance, and its benefits. We provide examples and resources for you to develop and implement a written transition policy in your practice. Finally, we provide quality improvement strategies and ideas to apply in PDSA cycles. Before you continue, please print the algorithm from the Transition Clinical Report. It outlines important milestones for transition planning, including the provision of the written transition policy. It will be helpful to refer to the algorithm throughout the training. Two important aims of adolescent healthcare are to increase a youth's knowledge about health and their independence with self-care for a smooth transition to an adult-oriented care model. An important milestone identified in the algorithm of the Transition Clinical Report is to provide families with a written transition policy that clearly describes a practice's approach to transition and introduces families to the concept and process of transition. The written transition policy explains how the practice will help the youth and family prepare for transition as the youth matures, sets a target transition age, typically between ages 18 and 21, pays special attention to the complex issues that may accompany the transition of youth with special healthcare needs, honors the preferences of youth and family, and defines roles and responsibilities for key stakeholders, youth, family members, and physicians during transition. A written transition policy benefits all members of the youth's healthcare team. Adolescent patients benefit from improved knowledge about personal health matters and increased participation in healthcare decisions and routines. Families benefit by having adequate time to prepare for their child's transition to adult care, which normalizes the process for all concerned. Families can encourage the adolescent's independence at a level consistent with his or her changing age, maturity, and ability. Physicians and staff benefit by introducing the concept of transition at an early age. They can educate and prepare youth and families for a change in roles and expectations during the transition years. They can guide youth in taking responsibility for their own personal health matters. They can enlist parents or guardians as partners working towards youth independence, defined by making informed choices and taking an active role in their healthcare. When developing a transition policy for your practice, describe your practice's approach to transition. Explain that transition planning is a normal process which prepares the adolescent for independent adult life and adult-oriented healthcare, gradually empowering the youth to assume their own care. Identify an approximate age of likely transition to an adult care model, allowing flexibility for special healthcare needs or social circumstances. For instance, planning transition close to a divorce, move, or serious hospitalization is not optimal timing. A transition policy notifies parents that your practice expects adolescent privacy with the clinical team. It lists the responsibilities of patient, family, and clinicians in the transition years. A well-written transition policy reassures patients and families that you will provide help along the way to make the transition smooth. It defines parameters around privacy and confidentiality. Privacy and confidentiality are critical elements of a transition policy. Concerns about confidentiality discourage adolescents from seeking necessary medical care and counseling and create barriers to open communication between the patient and physician. Youth need protected confidentiality to address issues such as depression, suicide, substance abuse, domestic violence, unintended pregnancy, and sexual orientation. When caring for an adolescent patient, the physician should offer him or her an opportunity for examination and counseling separate from parents or guardians. Your practice's transition policy should respect youth's privacy, making every effort to maintain confidentiality in terms of mental health, reproductive health, and substance use. Discuss any limits of confidentiality guarantees. For example, inform adolescents that you must report indications that someone is in danger, evidence of abuse, or diagnosis of certain communicable diseases to proper authorities. Consider informing patients who use their parents' insurance that services may appear on billing documents. Throughout the transition years, the physician should make a reasonable effort to encourage adolescents to involve their parents or guardians in healthcare decisions. Here are example transition policies that you can adapt to suit your practice's needs. Copies are available under the Tools tab. Here are some tips for informing families about your transition policy and spreading the word about the importance of transition planning. Provide a written copy of your practice's transition policy to the patient and family by age 12, perhaps at the state-mandated 6th grade physical. Document delivery and discussion of the policy in the patient record. It is human nature to forget more than we remember. Review the transition policy with patients and families every 12 to 24 months, or more frequently, as needed, for youth with special healthcare needs. Post the transition policy in a visible area, such as waiting rooms and treatment rooms, and include it in brochures and on your website. Support the policy with other transition information sheets, such as the ones shown here. Remember to adapt all written educational materials to the language and literacy levels of your patient population. For convenience, many project-developed materials for this course are available in English and Spanish. As mentioned, one must honor the preferences of youth and family regarding transfer of care to an adult model. It is important to avoid giving the impression that the practice is pushing patients out the door or hastening a change in care providers. Rather, reassure families and practice staff that the practice's role is to support the adolescent and his or her family in the journey to adult healthcare responsibilities. Keep in mind that transition is not a single event, but a process that is sometimes complex and emotional for all involved: families, adolescents, physicians, and staff. This is an excerpt from the Aims and Measures Grid pertinent to providing and explaining a written transition policy. It will guide your quality improvement efforts for this KCA. Quality improvement begins with the written aim statement. It describes what will improve, by when, how much, and for whom. In other words, it describes the optimal care for this KCA. The aim for this key clinical activity is to provide and explain the practice's written transition policy to patients ages 14 years and older and their families. If your practice does not have a written policy in place today, a stretch goal may be to write a policy, provide it, and explain it 50% of the time over the course of the next 6 to 8 months. If you have a policy in place, you might extend the goal to 70% of patients or more, and ultimately stretch to reach the suggested goal of 90% after 1 year. The aim naturally leads to a measure that allows data collection on the optimal care defined for this key clinical activity. Collect data for this KCA via a chart review. If the transition policy was provided and explained to the patient and family, it should be documented in the patient's chart. The chart review question is: has the practice's transition policy been provided and explained to the patient and family? Review the printed copies of the data collection tool and Aims and Measures Grid for the information related to this KCA. If you do not have copies handy, locate them under the Tools tab. This is an excerpt from the Barriers and Ideas for Change Grid. If you identify a gap in practice for this KCA, that is, if you score low on the data collection question, has the practice's transition policy been provided and explained to the patient and family? The first question to ask yourself is why? What obstacles or barriers prevented your practice from routinely doing this? We list some possible barriers in the column on the left. These include: the practice does not have a written transition policy to provide, staff cannot identify patients for transition planning purposes, staff did not provide the transition policy because they did not have enough time or forgot, and so on. Once your practice identifies the barriers, ask how you can overcome them. What changes can you test through PDSA cycles? Take a moment to review the improvement ideas for each of these barriers in the column on the right. All barriers and ideas for change for all KCAs are listed in the Barriers and Ideas for Change grid. Use the link provided to view and print the grid. Refer to the grid throughout the training to guide improvement efforts for transition planning in your practice. Brainstorm other barriers and ideas for change with your team. Test out the ones your team thinks are likely to succeed through PDSA cycles. Here are some resources introduced in this module to develop and implement a written transition policy for your practice. Resources include policies and guidelines regarding consent and confidentiality, and a variety of transition tools. Here are some articles and guides you may find useful. These and all other resources are included under the Tools tab. It is not what you do for your children, but what you have taught them to do for themselves that will make them successful human beings.